stand in solidarity with all health workers for Extinction Rebellion and the World Health Organization at a moment of unparalleled global crisis. It's an acute crisis, a global pandemic, but also an acute on chronic crisis, a syndemic, a synthesis of epidemics. Yes, a coronavirus, but a coronavirus that has created untold human carnage because of pre-existing poor health, devastating and increasing inequality, and environmental and social destruction that has created the conditions for new pathogenic viruses and variants to exert their lethal effects. Already, we see the beginnings of Western complacency, the tragically mistaken view that this pandemic will soon be defeated. Not so. The shocking disparity in vaccine access means that this pandemic will endure and threaten us for several years to come. And there is a lesson here as we confront the environmental emergency, the climate crisis before us. The COVID-19 pandemic has taught us that those countries that took early and decisive action protected the health and welfare of their citizens more successfully than those who delayed. The costs of inaction can be counted in the preventable deaths of millions. The costs of inaction can be measured in the scarred economies of countries that hesitated. The costs of inaction can be seen in the shadow cast over the futures of children and young people. The Lancet's countdown on health and climate change has documented sharp increases in heat-related mortality, higher risks of infectious disease transmission, and rising food and water insecurity. But the climate crisis is not merely a threat to health. It is a threat to life itself, all life, the intricate, delicate, and interdependent connections across the living world. The World Health Organization was the first to warn the world about the coronavirus pandemic in January last year. Most presidents and most prime ministers ignored WHO's warning to their cost. But that lesson of the dangers of delay is slowly being learned. The climate emergency is a much more far-reaching public health emergency of international concern than COVID-19. It's now time to accelerate our actions towards decarbonization, to accelerate progress to a less polluted and obesogenic environment, and to accelerate our commitments to education, employment, and social care, all in order to create the conditions for pandemic and syndemic preparedness. In one word, equity. Thank you.